We all know now a lot about PCV2, I believe. Just a quick reminder, PCV2 affects all ages of pigs, causes most severe disease in growing pigs. In growing pigs, it is associated with wasting, and the characteristic lesions of PCV2 are usually in lymphoid tissues, where it causes lymphoid depletion, associated with very large amounts of PCV2 antigen. If a pig gets infected with PCV2, this can have two possible outcomes, subclinical infection or clinical infections. Both of these outcomes are not something that the producer necessarily wants to happen to his pigs. And a good way to fight against these outcomes is to try to eliminate or decrease PCV2 to start with. One way to do this is to use commercially available PCV2 vaccines. Currently in the United States, I listed here the 3 top used products today, and you can see PCV2 is already head-to-head with Mycoplasma pneumonia, which sold in 2007 70 to 80 million doses. And on the 3rd position is Lawsonia intracellularis with only 25 million doses. So PCV2 vaccination is widely used, and it is estimated that more than 90% of all pigs that reach the market today did receive PCV2 vaccination. Currently in the United States, we have 3 different products that are available for usage. 2 of the products can be used as 2-dose products. 2 of the products can be used as 1-dose products. All of the 3 products are based on PCV2A. 2 are baculovirus expressed PCV2 open reading frame 2 antigen, and the other one is an inactivated PCV1-2 chimeric virus. All of the products are for usage in growing pigs 3 to 4 weeks or older. I put in this chart just to make you aware that using PCV2 vaccines is a good thing, and that is regardless of what product is being used. That is just a comparison of the 4 different vaccines. It also includes the cell vaccination that is available in some countries, and that is a comparison non-vaccinated pigs compared to vaccinated pigs, and mortality, reduction of mortality in all these vaccinated pigs. And you can see it's very similar. So what I'm going to do now is to start trying to answer frequently asked questions. The most commonly asked question is, what can be expected from a PCV2 vaccination? Expectations, and I summarized here expectations that we have, that we know, that have been proven under experimental conditions. PCV2 vaccines are able to reduce PCV2 viremia. They are also able to reduce PCV2-associated lesions. We have a remarkable reduction of tissue load of PCV2. We have also proven that nasal shedding and fecal shedding of PCV2 is reduced. On the other hand, if pigs were vaccinated in experimental settings, we saw that there was an increase in anti-PCV2 IgM antibodies as well as IgG and neutralizing antibodies. Most importantly, we also can know from experimental trials that there is a cross-protection between PCV2A and PCV2B, which means that other vaccines that are based on the A type protect against the B type. I put here a little sentence just to make you aware that we do have reports of PCV2C, and at this point we don't know if there is maybe a PCV2D and PCV2E, but these are still research questions that need to be answered, and we don't know if the vaccines are also protective against these types. But from the data we have right now, it looks very good. Under field conditions, we have similar positive results. It has been shown that in vaccinated pigs, mortality rate is decreased, back fat depth is reduced, and medication costs are reduced. On the other hand, we have an increase in daily gain. Feed conversion is much better in vaccinated pigs. Number of closeouts increases. I put here some very interesting slides that are research results from the last couple of months, and here summarized the results of 4 different trials in the US. where PCV2 Viremia was correlated with average daily gain with a linear regression model. And you can see the results here. The first image here shows the correlation in non-vaccinated pigs. And what that means is that pigs that had higher viremia levels, because this here is the viremia level, had a reduction in average daily gain. On the other hand, here we have vaccinated pigs, and here we don't have such a correlation. That means that vaccinated pigs have approximately the same average daily gain regardless of their PCV2 levels, which is a very interesting finding. And this finding was also confirmed in Europe just recently, where they did similar trials, and again, you can see here the same trend. There was a reduction in gain correlated with increase in PCV2 amount in non-vaccinated pigs, but not in vaccinated pigs. What this is based on needs to be further determined. So here is a chart of cases submitted to Iowa State University, to the diagnostic laboratory, and I put this in just to show you. We had our peak in cases in 2006 with more than 2,000 cases submitted that were diagnosed as PCVAD cases. At the same time, we started with PCV2 vaccination in the field, and you can see quite a dramatic reduction of PCVAD cases that we see in the diagnostic lab today. That may not only be due to lower numbers of PCV2 cases, it may also have to do with lower numbers of cases that are submitted to the diagnostic lab in general, but at least this gives you a trend. Another frequently asked question is the question on maternal antibody interference with vaccine efficacy. A lot of people still ask that question. We did a trial a couple of years ago where we divided pigs up into different groups based on their levels of maternal antibodies that they had at 2 weeks of age. Pigs that were negative, pigs with medium levels, pigs with very high levels. Some of the groups were vaccinated and some of the groups remained non-vaccinated. All these pigs were challenged later. And here is a figure on the pigs that were negative at vaccination. It's not surprisingly, after vaccination, we see an increase in IgM levels, and that is followed by an increase in IgG levels. The pigs were challenged here at day 28, and at this time point they already had very nice levels of IgG, so they were protected in this case. Here is the group with the medium level of antibody at the time of vaccination. The trend is not as clear as on the previous picture, but still you can see that there is an increase in IgM shortly after vaccination. IgG goes down until challenge, but then we see a response here right away to the challenge. In the pigs with the very high levels of maternal antibodies, we really cannot see a whole lot based on serology results. We can see that there may be an increase in IgM. There is definitely a decrease in IgG after vaccination, and then there may be a slight increase in IgG, but that is not as clear as on the previous figures. When we, on the other hand, look at the amount of PCV2 DNA in serum, which is the most important part here, we can see that there is a very impressive difference between vaccinated and non-vaccinated and pigs with high antibody levels and at high antibody levels and low antibody levels. Pigs that were vaccinated in here, they are light green and blue. Pigs that were non-vaccinated are red and yellow. And what you see here is the general amount of PCV2 DNA in serum at different days post-inoculation. So that would be 7 days, 14 days, and 21 days post-inoculation. The yellow pigs, the yellow bars here represent pigs that still had passively acquired antibodies at the time of vaccination. If you compare that to the other group of pigs that had high levels of antibody at the time of vaccination, was challenged later, there is a significant reduction of PCV2 DNA in the serum. That group of pig here, at 2 weeks post-challenge, we did not have one PCR positive pig in that group. So the vaccine resulted in a significant reduction of of incidence and amount of PCV2 antigen. And we know from other studies that antibodies not necessarily decrease amount of PCV2 DNA. So in summary, that vaccine that we used induced a very protective immune response in pigs with varying levels of passively acquired antibodies. Similar studies have been shown by other researchers. In addition, we also know that the success of PCV2 vaccines under the field conditions would further support that maternal antibodies are not important when it comes to vaccine efficacy. So our next question is, do maternal vaccine-derived anti-PCV2 antibodies interfere with PCV2 vaccine efficacy? That sounds very complicated. I will try to explain it a little bit further. It is possible some producers, due to cost reasons, went towards sow vaccination. And if a sow gets vaccinated, the question is, what happens if the piglet comes to a different producer, the producer decides to vaccinate the piglets with the same vaccine than what the sow received, and is there any interference with the maternal antibodies with the vaccine efficacy in this group here? We designed an experimental trial to prove that. We tested 2 different vaccines, and all these 2 different vaccines were either used for vaccinating just the dams, for vaccinating just the piglets, or for vaccinating the dams and the piglets. And all the piglets were challenged with PCV2B. Our results that we saw indicate that maternal-derived anti-PCV2 antibodies do not interfere with PCV2 vaccine efficacy in growing pigs. In fact, the pigs that came from the sows that had colostrum vaccine-associated antibodies and were vaccinated later had very similar results to pigs that did not come from sows with vaccine-associated antibodies. These 2 groups, they were not different at any testing day. So they had the same viremia levels, they had the same antibody response. And that was significantly reduced from what we saw in the positive control pigs. This is a figure out of that particular trial, and here we just compare the 2 different vaccines in the pigs that came from vaccinated sows and were vaccinated later. And you can see that they behaved very similar in terms of viremia. Viremia is demonstrated here as line, also in terms of antibody levels, which are the bars here. So another question is, when is the appropriate timing of PCV2 vaccine administration? As we all know, PCV2 vaccine should be administered as early as possible. We have confirmed with experiments that we did a couple of years ago that vaccination should be at least 3 to 4 weeks prior to expected exposure, and potentially that would lead to a vaccination age of 2 to 3 weeks, which is widely done today, and we know it works quite well. One thing that needs to be considered is that we probably don't want to vaccinate the pigs during seroconversion, because that might interact with PCV2 vaccine efficacy. Actually, we are having an upcoming trial to study that effect. And in such situations, it might be beneficial to vaccinate the sows to overcome these early situations where there might not be a good response. So the next question is one question that is very commonly asked, and that is the question, are 2-dose products more efficacious compared to 1-dose products? And is there a difference in duration of immunity between these products? To answer this question, we designed a trial where we had 6 groups of pigs. Pigs were vaccinated at 3.5 and at 6.5 weeks of age. They received 1-dose products and they received 2-dose products. They were challenged with PCV2 at 15.5 weeks of age. We are looking here at viremia data from that particular trial. If we just look, and I summarized here the 1-dose products and the 2-dose products. If we look at viremia data, it would appear that probably the 1-dose products resulted in a little higher incidence of PCR positive animals, and there was a higher amount compared to 2-dose products. However, both were significantly different from the positive control group. And there was a significant reduction in PCV2 Viremia in both of these groups. Most importantly, we also checked for microscopic lesions at the very end of the study, and the microscopic lesions, that is probably the most important outcome that we can measure under experimental conditions, and all the vaccine products resulted in similar lesions. There were essentially no lesions present in these pigs, and we did not find a lot of antigen in any of these pigs, in any of the vaccinated pigs. Of course, we did find lesions in the positive control group. So can PCV2 vaccines be administered in PCV2 viremic pigs, and what can be expected in such a situation in terms of PCV2 vaccine efficacy? Many people are asking this question because they are doing routine PCR on piglets at a very early age. Then they find out that they have 20% of PCR positive pigs, and usually then they call the diagnostic lab and ask what they should do. Definitely this is an area that needs further investigation, and in fact I'm having a study right now on trial where we test exactly that scenario. We have a group of recently exposed piglets that we vaccinated, and we will wait again 15 weeks and we will see what will happen after the 15 weeks. But in general, we know that PCV2 is widespread, and we know that subclinical infections are very common. We also know that PCV2 vaccination is very successful, and most of the time it has a very high success rate. This means we can almost conclude that there is possible no or only minimal interference with viremic pigs. So whenever someone asks me what they should do if they have PCR positive results, I would, in any case, I would recommend to go ahead with the vaccination, because the vaccination is a killed product, and if it has no benefit, at least it cannot hurt the pig. Another question is, can PCV2 vaccines be expected to be effective in pigs concurrently infected by several pathogens? This is a little bit more like what is going on under field conditions, and as we know, PCV2 vaccines are highly effective under field conditions. That already answers our question. Most of the pigs in the field are infected with more than just PCV2. Most have PRRS, SIV, several bacteria. Still, the vaccines have shown that they are effective. In order to further confirm the field results, we did trials under experimental conditions where we co-infected the pigs with PRRS and PCV2, and we have shown that PCV2 vaccines are very effective under these conditions. What we did not test yet is what happens if a pig is concurrently infected with a different pathogen at the time of vaccination. And as I mentioned previously, we definitely need to think about PRRS, and we probably need to further investigate that. Is it necessary to vaccinate incoming boars, and should older boars be revaccinated? I am dealing with several boar stud owners, and these boar stud owners, they are very concerned when they test the semen by PCR for PCV2, and they then email me or call me and ask me what they should do if they have PCR positive semen. I have here results from an experimental trial where boars were tested by PCR after experimental challenge, and all the black boxes mean that these boars were positive at these dates. So you can see that boars are very likely to shed PCV2. They can shed PCV2 for a very long time period. We have shown that PCV2 can be at least shed for 90 days post-infection. The amount of PCV2 in semen may change over time, so you may not always be able to detect the PCV2. Still, the question remains, what does it mean, and can it be prevented? I mean, that would be the more important question. Boar vaccination probably should be considered if it is a higher risk population, meaning if there is a mixing of incoming boars from different sources, or if the boar stud serves a very high health breeding herd with a known PCV2 negative status, which is very rare, but it may happen. So what we currently recommend is what we currently recommend is to vaccinate probably all incoming boars. We are not sure about if vaccination should be bi or annual. In the worst case scenario, I would probably go with biannual revaccination of the boars just to be safe, because PCV2 vaccination in growing pigs has shown that there is quite a dramatic reduction in shedding of PCV2 in different fluids, so that might as well be true for semen in boars. So should breeding herd use PCV2 vaccination pre-breed? Here's a picture of what may happen if pigs become infected, if sows become infected with PCV2 during pregnancy. This is an experimentally induced PCV2-associated reproductive failure. You can see here, almost looks like parvovirus infection. Lots of mummies in this case, enlarged heart, high amount of PCV2 antigen in heart tissue. We can see here there is a little bit of fibrosis in this herd. PCV2-associated reproductive failure in general is associated with PCV2 infection in naive animals. You may say there are not that many naive animals, but still there are naive animals, and we also have seen PCV2 reproductive failure lately in pigs that were seropositive to PCV2. So it can also happen in animals that have antibody levels. PCV2 infection of the dam usually results in fetal infection because PCV2 can cross the placenta, and then PCV2 has a tropism for myocardiocytes, and that can result in fetal death. It not necessarily always results in fetal death. These piglets may be born viremic and may be a source for infection of other pigs. We did a trial where we experimentally infected sows by the use of spiked semen. Semen was spiked with PCV2 inoculum, and then we had 4 different treatment groups in that particular study. We had a negative control group. We had a group that was vaccinated before we did the insemination with the PCV2 positive semen. One group that was infected 12 weeks before we did the insemination, and one group that was naive at the time point when we administered the PCV2 positive semen, the spiked semen. You can see here in the positive control, large amount of mummies. We had in 3 liters only 8 live-born pigs. If you look at the vaccinated group, same treatment, we had 24 live-born pigs and only 2 mummies. So there is quite some improvement with the vaccination before, with that under that particular experimental conditions. When we look at the piglets, we took the piglets right after birth without having them suckle colostrum, so that we would have an idea what happened to the piglets. When we look at the piglets, we did only have 8 live-born pigs in the positive control group. They all were viremic, and half of them had antibodies. If we look at the piglets from the vaccinated sows, we still had relatively high numbers of viremic pigs. So PCV2 vaccination of the dam does not prevent fetal infection, but what we can say, it prevented reproductive failure. And if we look at the IHC results here, we had only 6 piglets that had IHC staining out of 28, as opposed to 34 with IHC staining in the non-vaccinated pigs. So the vaccine had a very good effect under that particular study conditions. Is it necessary to vaccinate sows? We need to consider the possible positive outcomes of sow vaccination. We can reduce or eliminate PCV2-associated reproductive failure. We reduce or eliminate of giving birth to PCV2 viremic pigs, which might be a very good thing. We also increase passively acquired immunity in the piglets that have colostrum access. There is never just a positive outcome without a negative outcome. Negative outcomes, diagnostics becomes less clear, which might not be too important for the breeding herd owner. The other thing is that high passive antibody levels thought by some may interfere with effective vaccination of piglets, which we have proven in our other study that is probably not true. So we probably can really eliminate these possible negative outcomes, and we need to focus on the possible positive outcomes. So it might be beneficial to vaccinate sows. So now we are switching topics here, and I will now talk a little bit about diagnosing PCVAD in a vaccinated pig population. What tools are available and how do I interpret results? We do have serology. Serology is widely used by veterinarians and producers because it's an easy sample to get. What can and cannot be entered with regular anti-PCV2 IgG-based serology? If you have 10 samples, you submit them to the diagnostic lab and you get a negative result back, that may indicate that these animals had no previous exposure to PCV2. On the other hand, it may indicate that these animals are in an acute stage of infection because it takes at least 2 to 3 weeks for them to become positive. So that is a possibility. On the other hand, if you have a positive result, you need to consider that most herds are positive anyway, regardless of disease status. And then passively acquired antibodies, active infection antibodies, or vaccine-induced antibodies, they all look the same in the ELISA test. So there is no way that you can differentiate between those. So you really need to be very careful when you try to use serology for assisting in diagnostic investigations. Maybe you should think about doing cross-sectional bleedings, and maybe you should also think about using maybe an IgM-based ELISA assay versus an IgG-based ELISA assay. IgM-based ELISA assays are not commonly offered in diagnostic labs at this point. Serology, on the other hand, may be able to assist in vaccine compliance. So, can vaccine compliance be measured, and if yes, how is it done? Vaccine compliance in general answers the question, has the pig seen the vaccine or not, which is sometimes very important to the veterinarian. You need to keep in mind that vaccine compliance is no indicator of vaccine efficacy. So you may be able to prove that the pig saw the vaccine, but that does not necessarily mean that the vaccine really works. I mean, you would hope so, but the one thing does not exclude the other thing. PCV2 compliance, there are two different ways that we can look, two different versions that we can look at. First of all, we can try to measure antibodies against PCV2 because that would be an indication that the pig was vaccinated. Potentially that is not very helpful because, as I already stated earlier, most of the pigs are seropositive. So what does a positive result mean to you? Probably not a lot. So we need to think about different methods, and the other method is to measure antibodies against something else that is present in the vaccine but not in the pig. And that brings us to the baculovirus vector. That is the only thing that is present in the currently available vaccines that is not present in the pig. The hypothesis here is that antibodies against baculovirus are detected in vaccinated pigs and not in non-vaccinated pigs. In order for this to work, you need to consider that you need to use an assay that is actually able to detect anti-baculovirus antibodies. Not all of the currently commercially available assays are able to detect these types of antibodies. We look here at data from an experimental trial that we did, I believe, 2 years ago, and we vaccinated the pigs with different commercially available vaccines, and then we just looked at the development of anti-baculovirus titers. And you can see here, there is one group, after 2 weeks post-vaccination, we see a dramatic increase. So under these experimental conditions, we were able, in that particular group, to see that that group was vaccinated because they developed anti-baculovirus antibodies. In general, you need to be, if you use that assay, you need to be very careful with the interpretation because, first of all, we don't have any cutoff value at this point for anti-baculovirus antibodies. It appears that these antibodies appear after a second vaccination. They are not present after just one dose. At this point, we don't know how long these antibodies will remain in the pig, and which means if a dam received vaccination sometimes in the weaning age, maybe that dam still has anti-baculovirus antibodies present and will then give those antibody virus titers to the piglet. So we don't know anything about that at this point. So if you see an increase in antibaculovirus titer after vaccination, this may indicate that the pig received the vaccine. On the other hand, there are other reasons why that well can go up, and that would be non-specific binding. The other big one is that in old sows we commonly see antibaculovirus antibody titers, and we know that these sows have never seen a vaccination. So you definitely would want to be careful if you use a differential ELISA for vaccine compliance. A question that is frequently asked is the following. Is a serological response to PCV2 vaccination always seen and necessary for vaccine efficacy? Some people really like to use cross-sectional bleeding to determine if the PCV2 vaccination was effective, and they would want to see an increase in titers. I have here some data from an experimental trial that we did in 2003. We vaccinated these particular pigs. We vaccinated them right here at 0 days. And these green bars show the antibody response in these pigs. We had 12 pigs in each group, and you can see we had here 5 pigs that were negative at the time of challenge. We then measured viremia after challenge, which is indicated as yellow bar. The group that was not vaccinated had viremic pigs present. We did not see viremic pigs in any of the other groups. That would indicate that even pigs that did not develop visible antibodies, and we used negative control pigs, so we would have noticed if these pigs would have developed antibodies, even these pigs were protected. So a vaccine response is not necessarily seen, but pigs are still protected. So now we look at molecular diagnostics and the meaning of using molecular diagnostics for diagnosing PCVAD. The first possibility, if we submit some samples for PCR, we may get a negative PCR result. So that can mean that we did not have a previous exposure to PCV2. On the other hand, it can mean that the pig is in the resolving stages, because we know that when a pig is in the resolving stages, sometimes the viremia is eliminated, but PCV2 can still be present in selected tissues, such as lymphoid tissues. So if you have a negative result, it does not indicate that the pig does not have PCV2 somewhere in its body, in some lymphoid tissues. And of course, the other possibility is that the PCR result is false negative. We would not hope that that happens too often, but it happens. If we have a positive PCR result, we do know that PCV2 DNA is present. We don't know if that is viable PCV2 or not viable PCV2. It might just be that the pig became vaccinated and the antibodies carried around a little bit of that open reading frame 2 protein, and that was detected by the PCR. So we don't know if it's PCVAD or not. If we want to know if it's PCVAD, we need to go one step further, and we need to do quantitative PCR. I put in here a little figure. These pigs here, they were all PCR positive. Whenever that curve goes up, they are positive. Only these pigs here, where the line goes up very early, like at cycle 15, only these pigs here had clinical disease. All the other pigs were healthy. So quantitative PCR would be a way to differentiate clinically affected pigs or not. And then I made the comment that we definitely want to be very careful if we look at environmental samples, because with an environmental sample we don't even know how much amount we put into the PCR reaction to start with. With the serum, it's one way, it's very easy to put 200 microliter in, but with the environmental samples that becomes very difficult, and interpretation becomes really difficult. And then we may also deal with a false positive result. So which leads us to the third way of diagnosing PCVAD, and that is pathology and PCV2 IHC, which is of course the preferred method of diagnosing PCVAD anyway. So can pathology and IHC be used to interpret vaccine failures on a herd basis? I put in here a slide with an IHC positive staining, and that was a clinically affected pig. You need to keep in mind that it is necessary to have at least 10 to the 8th genomic copies in order to have any staining. So that is quite a bit, and that is quite a difference between PCR and between IHC, because with PCR, in general, you can assume that you will be able to detect one copy. And we also need to keep in mind the timeline of PCV2-associated microscopic lesions. If you are looking at a pig in a very acute infection stage, which can be anywhere between 7 and 21 days, you may look at a perfectly normal lymph node, and the pathologist will not note anything. However, when you do an IHC stain on that, it can potentially be already loaded with PCV2 antigen. Then the next stage would be the subacute infection. In that stage, we do have we have lesions present here, and we have small to high amounts of antigen present. In the chronic stage of infection, we have quite dramatic lesions present, and sometimes the IHC is completely negative. So then we report to our clients we saw PCV2-associated microscopic lesions, very severe PCV2-associated microscopic lesions. However, the IHC was negative. So then what usually happens is that the veterinarian calls in and asks, so could it be anything else? There is a possibility that it could have been something else, but the highest likelihood is that that was really a very chronic infected pig that just overcame the infection. Microscopic lesions and PCV2 IHC remain the gold standard for PCVAD diagnosis, but you also need to keep in mind that that is on an individual pig basis only. If you have a herd and you suspect there is a vaccine failure going on, if you send in one pig, and you probably would not have picked the best pig to send to the diagnostic lab, and if the pathologist diagnoses PCVAD in that one pig, you can definitely not interfere that is the case for the problem in all of the other pigs. On a herd basis, what we want to see is PCV2 lesions in more than 50% of the pigs examined, and one pig is certainly not enough for diagnosis. And we also want to see an increase in mortality. So if you're dealing with a PCV2 vaccine failure situation, things that need to be considered are, was the vaccine given at the right time and at the right dose? Many people still give these split doses at this point. Was only one pig in a herd affected? So that is in my mind a very important question, because the pathologist has no way. The pathologist is just looking at one pig. If I determine that it's PCVAD, that does not mean that all the other pigs that show clinical signs have also PCVAD. And no vaccine will protect 100% of the pigs. Another important point is that PCV2 vaccines are not effective against other pathogens than PCV2. So you cannot expect that PCV2 vaccines will protect pigs against PRRS outbreaks. So it's very crucial to do a good diagnostic workup and see what other pathogens are involved. And as I mentioned earlier, maybe at the time of vaccination there was a PRRS outbreak, and maybe that influenced the vaccine efficacy, but that does not mean that the vaccine was bad that was used. It was just the wrong timing. And another question that is quite frequently asked is the question if there is any interaction of the vaccine with IHC stains, meaning if we see PCV2 staining on IHC slides, is that due to the vaccine rather than a real infection with a field strain? We definitely can answer that is very unlikely, because I looked at a lot of pigs that were vaccinated and just vaccinated, and I know there is no staining in these pigs. So whenever there is a staining, usually it's associated with lesions, and usually that is due to a field strain, because other vaccines are killed strains. So they would not be even able to induce that high number of genomic copies that are necessary to induce IHC staining. So in summary, what do we know today on PCVAD? We have definitely a very good knowledge on pathogenesis in growing pigs. We are getting a little bit of better knowledge on PCV2 infection in sows and boars, but there is still some work that needs to be done. We need to increase our knowledge on epidemiology and spread of PCV2, and vaccines have had a very great impact. Evidence for vaccine failures is minimal.